if you go into maybe the younger patients, and we hear a lot of younger patients say, "Oh, well, I'll wait to do that until after I have kids."
Mhm.
Is that a good strategy, or that could that be delaying something that would benefit them now?
I think it's really patient dependent. There's certainly things that we would expect to happen. Let's say, having kids or pregnancy is a lot of stress on a patient's body, and some patients do go through that really well. Typically, the younger the patient is that goes through a pregnancy, the better they do, as far as getting their body back after a single pregnancy. Once you have two or three pregnancies, once those pregnancies take place a little bit later in life, like in their late 30s or 40s, that has a little bit more of a longer lasting effect on the body, which may be unfavorable. A big factor that I've noticed is patients who gain a lot of weight during their pregnancies tend to need a lot more work, so to speak. Only because that extra weight tends to grow skin around that weight. And even if they lose that weight later on, that skin does not shrink back. And now we have to deal with extra skin, and that requires additional procedures and things like that. One way to look at it is would be to just wait until you're done with childbearing and things like that before you sort of attack all these things. I think a smart thing to consider is sort of think about it preemptively. Like, let's I am pregnant, I'm going through this, it's a new experience, but at the same time, how do I optimize my own health? How do I focus? And I think controlling your diet even during those situations and staying healthy during that, maintaining your exercise regimen, may be a huge challenge, but it's a really big payoff in the end.
I want to back up to something you said that kind of made my head glitch when you said grow skin. So I assume that when you're pregnant, your skin stretches, but are you saying it actually kind of can grow? Or is that the same thing?
It's not,
Like, do we make
and that's a
do we
very
make
common
more skin
misconception.
cells?
Yeah,
Yeah.
that's exactly. So we make more skin cells. That's a another way to put it. But yes, if you think about it, if you take 100-pound person, and this is a hypothetical extreme, but if you take a 100-pound person and they gain 300, 200 pounds, and they're now 300-pound person, you are going to have a lot more skin around that weight, and a lot of that is growth, not just stretching. For some patients who are unfortunately, who have the unfortunate like poorer skin quality, sometimes when that skin grows and stretches at the same time due to rapid growth, like a pregnancy where the abdominal, the abdomen grows at the very end of the pregnancy, typically the last couple of weeks, they actually get stretch marks. Those are permanent. Okay, that is actually skin that is stretched so quickly in a small amount of time in a small area that the collagen just could not replicate fast enough, and it just split, and those stretch marks are permanent. Really, the only way to get rid of stretch marks is to cut them out. You can laser them and try to make them look a little bit more even, but that has minimal success. It does grow, and that's the thing, is like if you lose weight after pregnancy, the skin does not shrink back. And every mom who had one, two, maybe three kids will tell you that the skin around the abdomen is always just a little looser, no matter how well they take care of themselves, no matter how many sit-ups they do. That skin will never feel quite the same because there is actually more skin there now than there used to be.
That's so interesting. I just when you said it, I was like, "Really? It grows?" But, we don't know. So that's really new nugget of information that I learned today, and maybe everybody else out in the audience
But
too.
but it underlines
So,
the importance of maintaining weight because, again, if a focal growth due into pregnancy is very expected, usually your abdomen obviously will grow. Your breasts will grow to a certain extent as well because of the hormonal changes and with breastfeeding afterwards. But if on top of that growth, you then gain 30, 40, 50 pounds, then that makes a much bigger difference in the long term than not gaining those extra 30, 40, 50 pounds.
so how do you counsel maybe a younger patient who, let's take your lipo example of the flanks, or banana rolls right at the bottom of the buttock and along the side of the thigh, or I don't know, just tummy, or maybe their back. Is that something that if they think, oh gosh, I should wait till after I have kids, is there any reason for that, or how do you help walk them through what the best time to do something?
Well, that sort of goes back to our genetics. I mean, there are some patients who are born with, certain areas that are very favorable and other areas that may not be so favorable but are correctable. So, extra flank fat is one where that's, some patients are born with just, it's kind of like a square look. I've always had more volume here. No matter what weight I am, that proportion is always a little bit off. I'm always disproportionately more full in my flanks, or maybe I have saddlebags. That's a very common one as well. That is not going to change with pregnancy. It may increase or decrease with regards to its own volume as you gain or lose weight, but proportionately it'll always be there. So that is a very correctable issue that can be addressed at any time.
Well, and I think, if it is a matter of proportions and you're trying to change that, if you're 25 years old, waiting till you're 35 or 38 is that one, you're not going to enjoy it as long, which
Hmm.
that point of enjoying the result
Hmm.
and having the benefit of that result. But also, if you're younger, wouldn't your skin maybe do better with the retraction that you were talking about?
Sure. Yeah, to some extent, yes. I mean, there's definitely a higher collagen count in the skin in the younger patients, so it will do a little bit better.